It's empowering for people in communities to have their stories told, and it can make a real difference.
Appalachia has a deep bench of people who are incredibly committed to seeing change in the sexual and reproductive health of residents of these communities.
Throughout the country, there are glimmers of hope that are consistently fighting for access to reproductive care. For nearly 10 years, the All Access Eastern Kentucky Partnership has offered support in building the capacity of providers to create high-quality, comprehensive sexual and reproductive health care, and ensuring that all Eastern Kentuckians have the information, access, and opportunity to pursue the future they want.
All Access started over 7 years ago as a collaboration between Power to Decide as the national organization and 2 local Kentucky organizations, the Kentucky Health Justice Network and Appalshop.
We at Appalshop had a project called East Kentucky Reproductive Health Project with the Kentucky Health Justice Network, really focused on young people producing media about their experiences with reproductive health. An opportunity came up. A funder was looking for projects that would support improved reproductive health in Appalachia specifically, and so Power to Decide was interested in that. At Appalshop we were interested, and so we applied together and got the funding. The videos that the young people have done and shared, that whole process is so empowering for the person making the media piece, who often has felt like they didn't have a voice, they didn't have an opportunity to speak their piece. And then peers would see these films. It's also empowering for them. We show the videos in community groups to healthcare providers who are often totally unaware of how they might be turning off young people or creating an unpleasant situation in their practices. So if we can change that, that's really important.
The project was really focused initially around contraceptive access and ensuring that Eastern Kentuckians had access to the full range of contraceptive methods. Since then, All Access EKY has really expanded beyond just supporting contraceptive access.
This project is unique because there aren't a lot of other opportunities to have these resources and tools to allow people space to talk about these things and see beyond the stigma.
It's really hard. I grew up in a county where the majority of people were raised by their grandparents. There's a serious opioid epidemic, and I would say a big majority of kids in my school were raised by their grandparents. So you have to also think that there's that cultural aspect of sex being very taboo.
One thing I want people to know about reproductive health care in Appalachia is just that we deserve it.
People think that because we're less populated or lower income, that we're not as important as other places and that we can go without. But no, you gotta think of everybody.
Everybody deserves this care. Everybody deserves to be able to go to the doctor, talk about their reproductive issues, talk about these problems, and get the same treatment.
Reproductive health care in Appalachia is very scarce. There aren't a lot of clinics that offer the full range of birth control methods, even if you have the education to know what the full range of birth control methods are.
Inequities remain around reproductive health care, reproductive well-being, and access to care. The All Access EKY project is ensuring that all Eastern Kentuckians have the information and services that they need, like bedsider.org, like abortionfinder.org. People are able to get information that they need to achieve reproductive well-being and to live the lives that they want. By supporting All Access, you're also supporting the training and capacity building that we provide to folks so that they feel equipped to support their community's needs and to advance reproductive well-being in their communities.
People in this area, they're hungry for information and they want to talk about it, and they just don't have anyone to talk about it with. The biggest thing All Access is doing is starting the conversation to let people know that there are places where you can go to access services, to share things that you see, to be an open voice and to talk about it. Just so many things that give me goosebumps to talk about, because when people have appropriate sexual education, we are increasing the likelihood that people will be able to go on and achieve the futures that they want and deserve.